Thanks, Demetra. Well, one organization helping parents better understand what happens when teens use marijuana.
We do have a meeting being held tonight on it. We're going to get to that. Joining us is Dr. Bob Gabbay, the medical director for Destination for Teens. Thank you for coming in, Doctor. We understand this organization in place here since 2013. Tell us about what services you provide.
Sure. We provide services to adolescents in the community, a little bit more severe than outpatient, intensive outpatient treatment, and a day hospital for kids who are really struggling in school, not only with drugs and alcohol, but a lot of mental health issues like depression, trauma, anxiety, that they're really having challenges functioning in their day-to-day lives.
What do you do with someone who's not approaching this as a problem, but already consistently smoking pot? That parent out there in that situation, how do you address that with their teen?
So when you address a parent with a teen, you really want to explore with them what their understanding of pot is. You don't want to lecture them or berate them or anything like that, but try to figure out the function that the marijuana use or the pot is serving. Is it because they're having trouble sleeping? Is it that they're depressed? Is it that they're trying to fit in? And by really understanding the purpose that it takes, how is it having any kind of negative consequences? And you really try to tease that out by interviewing them one-on-one and taking the time to really know them well, because we really want to focus on the individual teenager and parent and family.
And we know that the brain isn't fully developed until what, age 26? Is that correct?
A lot of, even though physically our bodies develop in our teenage years and we're fully developed, really brain maturation is thought to occur fully until our early 20s. And adolescence is at a time as if you think the brain is forming and reforming, especially the frontal area of the brain where we make decisions, complex decisions, how to act, how to use judgment, that any kind of use of drugs or alcohol can really impact that, especially marijuana.
That's an example of a medical risk. What are societal risks? And if you could also add to that, what are one or two things parents in this situation really need to do? What kind of gems of wisdom could we leave those parents with?
I would always say try to be open with your teenagers. Try to talk to them if you feel that something is amiss. Try to mention what you notice. Hey, I noticed that you're seeming a little bit more isolated. You're seeming a little bit more down, more reserved. Or if you start noticing that their grades are slipping, or their attitude is changing. Again, teenage years are pushing the boundaries. They want to assess their independence. But if you really see that maybe they're losing touch with close friends or relatives, I think that's a sign to be aware of.
Keeping that line of communication open consistently.
Definitely.
And Dr. September, National Recovery Month, Suicide Prevention Awareness Month. You've been offering free classes and events for parents. One of those is tonight.
Right. But this afternoon at 3:30, we're having a parent education seminar. It's to really help parents and clinicians in the community as well. It's open to all, to really educate them about marijuana and teenagers. And it's to provide as a holistic approach as possible, since there's a lot of misconceptions in the community. And hopefully we'll clear that up.
And you have the Henderson location also based in California. That was very informative. Thank you, Doctor.
Thank you for having me.
All right. Thanks again. We'll have that information as well on our website for more information on Destination for Teens.